So, step inside the modern operating room for a second. It's probably not quite what you might picture from, old movies.
No, definitely not. It's a really high-tech environment now, a fusion, really, of advanced engineering and, well, incredible human skill.
And right there, often at the center, is the surgeon. But maybe not leaning over the patient directly with a scalpel?
That's right. Often they're seated at a console, looking at this high-definition 3D screen, controlling these incredible...
Right. Because surgery itself has evolved so much. From, traditional open surgery.
Big incisions, lots of trauma, long recovery times.
Exactly. To minimally invasive or keyhole surgery. Smaller cuts, cameras inside. Much better for the patient. Faster recovery.
Definitely better. But even standard minimally invasive surgery had its challenges.
Like what?
Well, often you were working with a flat 2D image on a screen. The instruments were long and rigid, kind of like operating with chopsticks almost.
Right, limited dexterity. And you lost that direct sense of touch, didn't you?
You did, the tactile feedback, plus a really steep learning curve for surgeons to master complex procedures that way.
Okay, so the first robots tackled some of that. Better view, more control.
Yes, the sources really emphasize that. Enhanced 3D vision, magnified, giving a real sense of depth, and instruments with wrists that could bend and rotate far more than human wrists or rigid tools.
Tremor filtering, too, you mentioned.
Yeah, smoothing out any tiny, unintentional hand movements. And it was just more comfortable, ergonomically, for the surgeon during long, complex operations.
But crucially, these were, as you said, telemanipulators. They just did what the surgeon's hands told them. No thinking involved.
Exactly. Purely extensions of the surgeon's control. Sophisticated, yes, but lacking any kind of built-in intelligence. They couldn't interpret the scene themselves.
And that is the big shift we're digging into today. Because now, as of 2025, artificial intelligence, well, it's changing the game entirely.
It really is. AI isn't just tweaking the robots, it's becoming this intelligent partner, weaving itself right into the whole surgical process.
So it's not just about better robotic arms, it's about giving the system a kind of brain.
That's a good way to put it. An AI brain that fundamentally changes how surgery is planned, how it's carried out, and even how surgeons learn and improve.
Okay, so our mission for this deep dive, using the material you shared, is to pull back that curtain, understand this fusion of robotics and AI and what it means for, well, for you, the listener, or someone you care about potentially needing surgery, how it might lead to safer, more effective treatments.
And understanding the journey is important. Open surgery.
Big cuts.
The MIS.
Keyholes, cameras.
Which was better, but still had those limits. We talked about the 2D view, the rigid tools, loss of touch, that difficult learning curve.
Right. Then came the first robots addressing the view, the dexterity.
Yeah, the 3D HD vision, the wristed instruments, tremor filtering, better ergonomics, huge improvement.
But still, fundamentally, just following the surgeon's direct commands. No analysis, no intelligence.
Correct. They were sophisticated puppets, in a way. And now AI is stepping in, transforming that puppet into more of a cognitive assistant.
Across the whole process.
Yes, right across the surgical pipeline. And it actually starts well before anyone even enters the operating room.
Before surgery, how does AI help with the planning phase?
This part is really fascinating. The sources talk about AI algorithms crunching massive amounts of pre-operative imaging data. CT scans, MRIs, ultrasounds.
Okay. What does it do with that data?
It doesn't just display the scans. It uses that data to build these incredibly detailed, patient-specific 3D anatomical models, like a virtual replica, a digital twin of that specific patient's anatomy.
Wow. So a surgeon can literally explore a perfect digital copy of, say, my insides before the actual operation.
Precisely. And the AI goes further. It helps identify and map out critical structures within that model. Things like blood vessels, nerves, the exact boundaries of a tumor.
All highlighted clearly.
Yes, relative to healthy tissue. So the surgeon can plan with extraordinary detail.
What kind of planning are we talking about?
Really meticulous stuff. Using these AI models, they can map out the best incision points, figure out the safest path for instruments to avoid hitting those critical nerves or vessels. They can even simulate the procedure virtually.
Like a flight simulator, but for surgery.
Exactly like that. One source described it as rehearsing every single step before the mission even begins. A highly detailed dry run.
That sounds incredibly valuable.
It is. And the AI can also fuse data from different types of scans, maybe overlay MRI data with PE scan data to get a complete picture of both the structure and, say, the metabolic activity of a tumor.
And this detailed plan doesn't just stay on a planning computer, right? It comes into the OR.
That's right. Often using augmented reality, or AR, that AI-generated plan with all the mapped structures and pathways can be projected directly onto the surgeon's view at the console during the actual surgery.
So it's like a live digital roadmap laid over the real view.
Exactly, guiding them in real time.
Okay, planning is one huge aspect. But what about during the surgery? How does AI assist then in the moment?
Yeah, so intraoperatively, AI acts almost like an intelligent co-pilot. It's constantly analyzing the live video feed coming from the camera inside the patient.
What's it looking for? What kind of analysis?
Well, one really powerful capability the sources highlight is AI-powered image segmentation.
Segmentation. What's that?
It means the AI can automatically identify and visually distinguish different types of tissue based on what it sees. Like automatically highlighting cancerous tissue in one color, healthy tissue in another, maybe outlining critical blood vessels or nerves on the screen for the surgeon in real time.
Wow. That's like giving the surgeon GPS navigation inside the body.
That's a great analogy. It provides instant visual clarity, augmenting the surgeon's own expertise and anatomical knowledge.
And it does more than just highlight things.
Oh, yes. The AI also tracks the exact position of the robotic instruments relative to both the patient's anatomy and that preoperative plan we talked about.
So it knows where the tools are and where they're supposed to be.
Precisely. And it can provide alerts if an instrument gets too close to a predefined high-risk area, like a major artery or nerve identified in the plan.
Like a warning system.
Exactly, a safety net. Some of the more advanced systems, according to the sources, might even incorporate things like virtual fences or no-fly zones.
No-fly zones, what does that mean?
It means if the surgeon's instrument moves towards one of these predefined critical areas, the robot might provide a subtle haptic feedback, like a little resistance or a clear alert, just an extra layer of guidance away from danger.
Okay. And you mentioned visual enhancements too.
Yes. AI can help stabilize the view, digitally compensating for tiny movements like the patient breathing, keeping the target area steady. It can also use image processing algorithms to enhance subtle details, making tissues or anatomical planes clearer.
So it's this constant, intelligent feedback loop happening during the surgery, enhancing precision, enhancing safety.
That's the core idea, real-time intelligent support.
Now, we sometimes see headlines, maybe slightly sensationalized, about robots doing surgery all by themselves. Is AI actually performing full operations autonomously now in 2025?
Right. It's really important to be clear here, and the sources we reviewed are very consistent on this point. Fully autonomous surgery is not the current reality or even the immediate goal. That's not what this is about right now.
Okay, so what is AI doing autonomously, if anything?
The focus is much more on AI assisting with or automating very specific, often highly repetitive or microscopic subtasks, and always under strict human supervision.
Can you give an example? What kind of task?
Sure. Things like automated suturing of extremely small blood vessels where the precision and steadiness required are immense, or perhaps executing a very precise dissection along a clearly defined path that was pre-planned, tasks requiring unwavering consistency.
So the AI handles that tiny, super precise, maybe repetitive part.
Yes, but the surgeon is always in command. It's more like shared control or supervised autonomy. The surgeon initiates, oversees, and can instantly take back full manual control or override the AI at any second.
That seems crucial. Safety and ethics must be paramount.
Absolutely. Development and deployment, especially of anything involving autonomy, is incredibly cautious, involving rigorous testing, validation, and strict protocols. The human is always the captain of the ship.
Okay, so beyond the planning and the real-time assistance during the procedure, are there other ways AI is impacting surgical practice?
Yes, another significant area mentioned in the sources is surgical training and skill assessment.
How does AI help train surgeons? Seems counterintuitive almost.
Well, think about evaluating performance. AI algorithms can analyze surgical performance with remarkable objectivity. They can review video data from training simulations or even anonymize real procedures and measure things.
Measure what?
Things like how efficiently the instruments were moved, the total path length they traveled, how long specific steps took, even the amount of force applied to tissues, and whether the technique followed established best practices.
I see. So instead of just a mentor saying, that looked a bit clumsy, you get actual data.
Exactly. Detailed, objective, quantifiable metrics. It can pinpoint specific areas where a trainee needs to improve, potentially making the learning curve less steep. And it's not just for trainees. Experienced surgeons can use it too for detailed feedback to refine their skills even further.
Okay, so we've got this picture. AI enhancing the planning, providing real-time guidance, helping with super precise microtasks, improving training. Let's bring it back to the patient. What does all this actually mean for someone like me or my family if we need surgery? What are the tangible benefits?
Right, this is a crucial output. The sources point to several key benefits for you, the patient. First, that enhanced precision and guidance often means less trauma to surrounding tissues,
Which translates to
less blood loss during the operation, and often significantly less pain afterwards.
less pain is always good. And less blood loss suggests a smoother recovery.
Generally, yes. Patients undergoing AI-assisted robotic procedures often experience shorter hospital stays. They can get back to their normal lives, their work, their families, much quicker than with older methods.
And what about the risk of things going wrong? Complications.
That's another major potential benefit highlighted. By helping surgeons see critical structures more clearly in real time, tracking instruments, providing those safety alerts, it all contributes to navigating complex anatomy more safely. This can lower the risk of complications, like accidentally damaging a nerve or a blood vessel.
Does this kind of technology also mean that maybe more complex surgeries could become more widely available, not just in specialized centers?
That's a potential positive outcome, yes. By augmenting a surgeon's abilities and providing this sophisticated guidance, these AI-enhanced systems might enable more surgeons in more hospitals to confidently perform highly complex procedures that previously required a level of specialized expertise perhaps only found in a few major centers, so potentially broadening access to advanced care.
And thinking about really critical operations like cancer surgery.
Yes, for conditions like cancer, that microscopic precision is incredibly important. It can be critical for achieving clear margins, making sure all the cancerous tissue is removed while preserving as much healthy tissue and vital organ function as possible. That has huge implications for long-term quality of life and potentially for survival outcomes too.
Okay, those are compelling benefits for patients. But what about the hospitals, the healthcare system? These systems sound incredibly expensive.
They are. The initial investment is definitely substantial, no question. That's a major point in the sources. However, there's also discussion about the potential for overall cost savings down the line.
How so?
Well, if patients have shorter hospital stays, fewer complications that require extra treatment or readmissions to the hospital, those things save money. So the argument is that the downstream benefits, improved efficiency, better outcomes can potentially offset that high upfront cost over time.
Makes sense. Plus, better patient satisfaction, hospital reputation.
Exactly. Being able to offer this cutting-edge care is important for hospitals, attracting both patients and, frankly, top surgical talent who want to work with the best technology.
So we have this picture of an increasingly intelligent operating room. The robot is more than a tool. It's like a cognitive partner now. Where does this leave the human surgeon? Is their role fundamentally changing? Are they less important?
That's perhaps the most critical takeaway from all the sources we looked at. This technology augments the surgeon. It empowers them. It absolutely fundamentally does not replace them.
It's a partnership.
It's a partnership.
Yeah.
The future operating room, as described, relies on the synergy between human expertise and AI capabilities. The surgeon remains the ultimate decision maker, the leader.
So the surgeon brings the judgment, adaptability.
Indispensable elements. Judgment calls, especially when something unexpected happens. Maybe the patient's anatomy isn't quite like the scan suggested. The ability to adapt instantly to unforeseen circumstances. And crucially, the ethical reasoning, the empathy, the human connection with the patient. AI can't provide that.
So the AI brings the superhuman senses, the stability, the data crunching.
Exactly. AI offers that incredible precision, the unwavering steadiness, the ability to analyze data in real time, see patterns maybe a human wouldn't, things that enhance perception and execution.
And the surgeon integrates all of that.
Yes, integrates it with their years of training, their experience, their clinical intuition, to make the complex, nuanced decisions that define the art and science of surgery. It's human intellect amplified by AI. Together, they can achieve a level of care that neither could achieve alone.
It really does sound like an incredible leap forward.
Yeah.
But, with any powerful new technology in healthcare, there must be hurdles, right? Challenges to getting this widely adopted.
Oh, absolutely. And the sources are quite open about these. A major one, as we touched on, is the cost. These systems are expensive to buy, expensive to maintain. That high price tag can be a real barrier, especially for smaller hospitals or healthcare systems with limited budgets.
Which raises concerns about accessibility, equity.
Definitely. There's a risk it could widen health disparities if only certain institutions can afford it. That's a serious consideration.
And training. Surgeons need to learn how to use all this complex tech effectively.
Yes, extensive training is required. It's not just learning to use the robot, it's learning to work with the AI, interpret its outputs, understand its limitations. Developing standardized, effective training programs is crucial.
What about potential issues with the AI itself, like bias?
That's another concern raised. If the AI algorithms are trained on data that isn't diverse or representative of the whole population, there's a risk of algorithmic bias creeping in, which could potentially affect performance or recommendations for certain groups. Ensuring fairness and equity in the AI itself is vital.
And the whole regulatory side must be complex, too, getting these advanced AI features approved.
Very complex and constantly evolving. Regulators need to ensure these systems are safe and effective, especially as AI takes on more active guidance or semi-autonomous roles. It requires rigorous validation, clear standards, and ongoing monitoring.
And what happens if something goes wrong? Who is accountable when AI is involved in a decision or action?
That's a huge ethical and legal question. Defining liability and accountability in AI-assisted surgery is a difficult challenge that needs careful consideration and clear frameworks as the technology becomes more integrated.
So these aren't trivial challenges. Cost, access, training, bias, regulation, accountability.
Not at all. They require ongoing dialogue, dedicated research, careful validation, strong ethical guidelines, and a real commitment to ensuring safety and equity as we move forward.
Okay, so stepping back and looking at the big picture, this fusion of AI and robotic surgery, it really represents a profound shift, doesn't it?
It truly does. We're moving towards an era where surgery can be planned with a level of detail we've never seen before, using these virtual patient models, executed with microscopic precision, guided by real-time data insights.
And constantly improved through AI-driven analysis of performance.
Right. It's not just about having sharper tools. It's about having smarter tools and intelligent partnership in the operating room.
But the goal remains the same.
The ultimate goal, yes. To empower human surgeons, give them capabilities that honestly felt like science fiction just a decade or two ago, enabling them to deliver the safest, most precise, and most effective care possible for their patients.
The AI guides, it enhances, maybe it performs certain microtasks, but the surgeon's expertise, their judgment, their humanity, that remains central.
Absolutely. The future of surgery looks undeniably more precise, more intelligent, but it remains profoundly human-led. That synergy is where the real power lies. It holds immense promise for transforming outcomes, making difficult procedures safer, and hopefully making the recovery journey smoother for patients.
It's an exciting future. But considering everything we've discussed, the incredible potential for better patient outcomes and enhanced precision, balanced against those very real challenges around cost, access, training, potential bias, and even accountability, it really makes you wonder, doesn't it? What does the responsible development and rollout of this powerful technology look like? And perhaps more importantly, how can we ensure its benefits truly reach everyone who needs them and not just a select few?